Hi Tara, good evening. Am I audible?
Yes, ma'am. Good evening, ma'am.
Good evening,
Good
ma'am.
evening. Yeah, good
Yes, you're
evening.
audible, ma'am. You're audible, ma'am.
Yeah.
Good evening,
I'm
ma'am.
near the ladies' hostel. Good evening. Da, Deepu, good
Good
evening.
evening, ma'am.
Good evening, ma'am.
Good evening, good evening.
A very good evening to one and all present here. On behalf of Kairali Society of Oral and Maxillofacial Pathologists, I'm extremely honored to welcome you all to today's webinar on setting an oral pathology, private practice, opportunities and challenges. In fact, very relevant topic in the present scenario, as the new graduates in our specialty find it difficult to establish themselves in academic arena. Setting up an exclusive oral pathology lab can indeed be a promising venture. Today, we have with us a specialist in this field who not only envisioned the possibility of creating one, but turned that vision into a reality. I welcome Dr. Deepu George Matthew, Professor and Head of the Department of Oral and Maxillofacial Pathology and Microbiology, Annur Dental College, Muatupura.
Thank you, ma'am.
Sir is also a founder partner and supervising oral pathologist of Nirnaya Orofacial Diagnostics, which is an exclusive oral pathology diagnostic center since 2016. Sir has numerous funded research projects under his guidance and has various international and national publications to his credit. Sir has also delivered numerous guest lectures on various international and national platforms. He has been awarded for Best Photography in Oral and Maxillofacial Pathology by IAOMP 2008. He was also an advisor for the project proposal which secured SA Waxman Prize from Aspic Clubs, a student engagement initiative for Asia Pacific for undergraduate proposals on antibiotic resistance. Sir has also guided the project which secured second prize Young Scientist Award conducted by Chennai Medical College Hospital and Research Center, SRM Group. I welcome you, sir, to the webinar. The moderators for today's webinar, Dr. Maggie Jose, Professor, Department of Oral Pathology, Enepoya Dental College, Bangalore. I welcome you, ma'am, to moderate the session. And Dr. Nivedita Baiju, Professor and Head, Department of Oral Pathology, Indira Gandhi Institute of Dental Sciences. I welcome you, ma'am, to chair the session. Over to you, Deepu, sir.
I'll do the screen sharing now. No?
Yes, sir.
Has it come to full screen now?
Yes, sir.
Yeah. So thank you so much for that kind introduction, Dr. Tara. And I'd like to thank, at this moment, I'd like to thank Dr. Sunil sir, President of KSOMB, and Honorable Secretary Dr. Mahija, for giving me this opportunity and encouraging me to share my experiences here. So the topic I feel that we have today, that is oral pathology in private practice, opportunities and challenges, is very relevant, as Dr. Tara has mentioned. So I felt like it is important for me to share my experience, like what has happened for me for the past 7 years, like where I have just tried out how this private practice in oral pathology is going to work out. So I just like to share that experience with you guys. So this is where I come from. This is where I work, Annur Dental College and Hospital. It's in Muatupura, near to Cochin, in the central part of Kerala. And this is where we work. Like, this is where our department is. And this is when, like, and after the rains, like, how the college looks like. Now, what is really happening to our specialty? We can see that, like, from 1995 onwards, like, if you look up to 2018, you can see that, like, up to 2000, there was no many number of dental colleges. And suddenly there is a sudden spike in the number of dental colleges. But when you see here, until 2010, there is actually a deficiency of or pathologists, and these colleges were running around to see if anybody is available for academic jobs. And that was one of the golden times for or pathology, where in which people were just minting money, they were getting huge salaries, getting these academic jobs in these colleges. And suddenly everybody felt okay, and if you start an MDs in orthopathology, all these postgraduates are going to come and they're going to make money. And so all the dental colleges started to have orthopathology postgraduate programs. And then there was a steady rise in the people or postgraduates in orthopathology who are coming out. So in the end, what happened is after 2015 or something, the number of colleges started to no more new colleges are coming after that. The dental council put a cap over the number of new dental colleges that has been allotted. So there has been a plateau over there. You can see after 2015, from 2010 onwards, there has been a plateau, and you can see that no more new dental colleges are coming. But the number of postgraduates who are coming out, or pathology postgraduates who are coming out, are steadily increasing. So in the scenario, what is going to happen when you see about the supply and demand, you have more number of orthopathology postgraduates who are passing out and less number of academic jobs that is available. So this is the scenario. You can see the dental colleges, around 174 dental colleges are there, while the number of orthopathology postgraduates output per year is around 559. And wherever you're going to accommodate all these orthopathology postgraduates who are going to come out, it's not possible to have these new graduates who are coming out to be employed in an academic jobs in a dental college. So now what is happening, the current scenario, that what's happening is nobody is willing to join for a postgraduate program in orthopathology, because everybody feels there is not much opportunities available after finishing a post-graduation in orthopathology, because from the undergraduate level, the kind of perception that people have got about orthopathology is that it is a non-clinical branch, which I very much disagree with. So I think even a lot of publications also started to come about describing about the fate of orthopathology as a specialty, and they have put great headings is it a sinking ship, or people are started to talk about alternate career paths after finishing the post graduation in orthopathology. So even in 2016, during those periods, this kind of a doom was there, when you talk to any postgraduates in orthopathology specialty. So I remember still in 2015 and 14 and all, when I call my postgraduates for seeing the slides and all, they will start complaining, or they will start saying, sir, what is the use of seeing the slides? Anyway, we are not going to have a job in this particular specialty. So there is an overall gloom in about or a kind of depressing kind of view about our specialty. So that has been the predominant feel about our specialty. Even now, I think majority of the people hold on to this kind of a view. Now, what we need to understand is every problem is an opportunity for a creative solution. So whenever you hit a roadblock, there is always going to be an opportunity waiting for you on the sides. So that is something that you have to keep it in your mind. So whenever you are in a problem, always you have to think out of the box, and you will get a lot of ideas where you'll be able to overcome these kind of challenges that you're going to face on the way. So when a young orthopathologist don't get academic jobs, the first thing they're going to think about is, okay, why don't I go for a general practice? Now there is one issue, maybe for 3 years they have been trained in orthopathology, and they may not have that kind of a clinical skill. For 3 years they may be out of that the clinical touch would have gone, and that becomes a big disadvantage for them. Now imagine that if you're planning to go for a general practice, you're going to set up a clinic. What you're going to do next? The first thing you're going to do is you're going to go and you're going to start working as an assistant along with a flourishing practitioner, so that you will know the tricks and or the tips of how to manage a practice, a general practice. So you have a precedence, and when you or you can go to a senior who has already have a good practice and ask advice from him, and from his experience he will be able to guide you regarding how to set up a general practice. Now, when it comes to if you're planning to have an orthopathology practice, if you're looking for a precedence, there is no precedence available. You look around, you don't see anybody who has done this kind of a practice. So that was a scenario now when I was when I heard all these kind of complaints from my postgraduates. So if you look around, you don't see anybody practicing orthopathology. So there is no. So the reason why most of the people don't go for practicing pathology is there is no precedence. There is no there is no way for them to follow, or there is no guidelines for them to follow. So there is no business model available for an pathology practice. That is one of the biggest disadvantages why people are not practicing pathology. One of the disadvantages. So in order to overcome this issue, that is why we started with the concept of starting in pathology practice. Now you have to understand that whenever we start with a business, you have to understand this is not an academic talk. This is more of a business talk. And when we plan to start with any kind of a venture, you have to understand where you are coming from and which place you are setting up the practice. And for me, I am from Kerala, and I am residing here. And the specialty of Kerala is it has got a high human development index. That means that literacy rate is very high, life expectancy is very high. So people are very literate, and they have high expectations about their healthcare. Now, if you look about the perceptions of the patients coming to a dental clinic, especially in Kerala, you can see that most of the people who come to the dental clinic are people with a higher and middle socioeconomic state. That means that what all are the characteristic features of these people who are coming to a dental clinic in Kerala? They have less time, like people who are on the higher social, their time is very precious, and they need the privacy, they need quality management. They're not worried about cost. If you bring down the cost, they have a feeling especially in, I feel like in the Ernakulam area, and if you try to bring down the cost, they have a feeling like they're getting a substandard kind of treatment. So they're not going to bargain much on the cost. And they are highly stressed people, maybe they are office going people and they have a lot of stress in their life. So very high incidence of lichen planus in these patients. Now, most of them have got a lot of information, and there's an information overload coming for them from internet and WhatsApp media and all those kind of things, social media. So most of them have got this cancer phobia. So, and they don't want to go to dental colleges because they don't want to spend time over there. They don't want the students to see them. They want their privacy. The time is very precious for them. So they don't want to go to dental colleges. So these are the kind of people who end up in the dental clinics usually. Now, what about the problems faced by the dental surgeons, especially when they are sending a biopsy or they're trying to do an oral mucosa, trying to manage an oral mucosa lesion? One is frequently I have heard from surgeons and other practicing clinicians that the quality of the reports that they get from a general pathologist are not that great. And because they're not able to, whatever the diagnosis comes from those reports, they're not able to correlate that with the clinical findings, because the general pathologists don't have any idea how the clinical scenario is, and they don't give the diagnosis based on the correlation with the clinical findings. So the clinician who gets the reports are not able to make treatment decisions based on these reports that the general pathology labs are giving out. So that is one problem faced by the dental surgeons, because I have frequently talked with many maxillofacial surgeons, and they have expressed this particular concern about it. Another reason is they don't have the opportunity to interact with the pathologist. That is another big issue that is having over there, because they may want to discuss the cases with the pathologist, and they want to get an input about it and how to go about with it, and what all are the precautions that they have to take, how long they have to follow up the patients. All those kind of things, they want to interact with the pathologist, but that opportunity is not there, especially in the corporate setup labs, because the the owners are not pathologists. Pathologists are employed over there, and they don't want a direct interaction between the clinician and the pathologist, because after some time the pathologists have got enough contacts with the clinicians, he may start a lab of his own. So they don't want that to happen. So they don't encourage direct interaction between the clinician and the pathologist. And next is where to send these specimens. For them, the convenient thing is sending it to a general pathology lab, because they have a lot of collection centers and all those kind of things are there. But sending these cases to dental college, it's very difficult for them. So they take the easy way out. So these are the problems that is faced by the dental surgeons. So what we have here is we have patients who are dissatisfied, who has a lot of problems. We have dissatisfied dental surgeons. And then when you have these kind of complaints and when you have problems, there is an opportunity always there. If you can solve these problems, you have a business opportunity or a venture opportunity is opening up for you. So there is an opportunity there. So you can see that in one hand, you have an orthopathologists who are jobless, who are skilled, and they don't have enough avenues for utilizing their skills. On the other side, you have a dissatisfied patients, you have dissatisfied dental surgeons who are not happy with whatever reports they are getting from a general pathologist. And if you can bring these two people together, you have an opportunity there for a new venture. So that is where we started, like me, along with me, Dr. Jubin, like who is now the professor and head of Malabar Dental College, and Dr. Karish, who is an oral medicine person. Now he is in Bahrain. So three of us thought about, like, we were all working together in one college at that time. So we all grouped together and we thought, like, why don't we start a venture like this? And we thought, like, each of us will invest, like, put 1 lakh into the thing, and we will start with 3 lakhs as a seed money. Like, we will start a new venture. So that is how we came up with an idea of starting a practice, especially we will have an exclusive oral pathology lab. Along with that, like, we will club the oral medicine people also, so that, like, they will be able to give consultations to the dental clinics. So that is how we started with this Nirnaya orofacial diagnostics and treatment. So whenever you're starting with a business or a new venture, you have to understand who is your potential customer. One of the biggest problems that often an oropathologist face is they always feel like they are going to their potential customer or a client is the patients. But what we have to understand is it is not the patients who are our clients as a pathologist. It is actually the dissatisfied dental surgeons who are our clients. Because the patient comes to the dental surgeon, he takes the biopsies, and the biopsies comes to us. So basically what we have to understand is, for a pathologist, it is the client is actually the dental surgeon or the clinician rather than the patient. We may not have to always interact directly with the patient, but we have to interact all the time with the dental surgeon. That is why I think there was a novel called Final Diagnosis by Henry Denger, in which he has it's a story about two pathologists, and he mentions a pathologist as a doctor's doctor. That is why, because for us, like, the clients are the other clinicians or the doctors, not really the patients. So the vision for our lab was affordable quality oral healthcare for all. And the mission is empowering the clinician with diagnostic and treatment services and innovations for affordable quality oral healthcare. Now, the reason why I told you, like, why we have to understand the potential customer is, in the end, we are all a part of a team who is going to provide quality care for the patient. But in the end, you have to understand that our role as a pathologist is to empower the clinician to give a better service to the patient. So we have to keep, if you want your business to succeed, you have to keep the clinician happy and give him the enough information, or like support him in such a manner that he will be able to do quality treatment or give quality care for his patients. So let's talk about the past, present, and future of our lab and how it was going on. So along with that, you'll get all the tips of what all things we experienced, and, like, even when you are putting up a practice like this, we are planning to set up a practice like this, what are the challenges and the opportunities that you're going to encounter. So the first 2 years, it took around 2 years for us to make an economically sustainable business model, to develop a business model, because we didn't have a precedence before. We didn't have anybody to follow. And so we had to do a lot of things by trial and error, and some things failed, and then we had to improvise, and we had to start with the new ones. So it took around 1 to 2 years for us to bring up a business model. And once it became break even, and when we were able to sustain ourselves, then it took around 5 years for us to have a pan-Kerala presence, so that we'll have cases coming from all over the Kerala. That is the present scenario that we have now. And in future, we are planning to venture out into molecular diagnostics and radio diagnostics. So if you look at Kerala here, so when we started in and around that Ernakulam district, in the small place we started. So I'm going to tell you, share my experience about initially in 2016, when we started, how we started this lab, and what were the steps that we took in order to start this lab. So this is a small area in which we thought we are going to initially start our project with. And so this part is actually a semi-urban area with 5 major towns and 2 local IDEA branches are there. Around 200 dentists were there in this particular locality, and around 150 clinics were there. So what we planned was and around 5 dental colleges are there. That is the important thing. And with histopathology services. And active general labs with histopathology services were also there. So we initially thought like, who is going to be our competitor? So there is like 1 or 2 corporate general labs are there, like with wide network all over the state. For them, the to pick up the tissues and the cases and all are not at all a difficulty, and they have large labs. So with them, we have to compete. So we need to have a strategy in order to manage this competition. So that is where how are we going to compete with them? So that we need to have a strategy in order to manage this competition with these big corporate labs. But for them, like oral and maxillofacial lesions are a small, tiny bit in their like huge chunk of cases that is coming to them. And we also decided that we are not going into hematology, because hematology is more of an automated kind of way in which the results are coming. So if I go into that, like I have to invest a lot, and it's very difficult to compete with the corporate lab. So we thought like we will concentrate only on histopathology and cytopathology of oral lesions. So we'll consider that as a niche market. And we also thought like we will arrange consultants for diagnosis, biopsy, and management, because that is one of the areas where the clinicians are finding it difficult to manage the cases. And we also thought that we will do an on-call tissue pickup from clinics. So if the clinics calls us, like we will arrange for a tissue pickup. So initially we thought that, but in course of time, we found that that is a big difficulty. That logistic part is the most difficult part in the whole scenario. It's not about diagnosing cases. It's about like every time a clinician calls like from somewhere to pick up the cases, which are like something that we had promised. And it's not easy to get people over there and get the tissues and cases from there. And the charges that you have to give for the people like who are picking up the cases, like with that, the profit margin comes down. So that was one of the difficulties like that we had faced in the initial period. Now, the other important things that we promised to, we thought like we can promise is the reporting is going to be done by an oropathologist, and definitely we are going to have a personal interaction between the oropathologist and the clinicians. So that kind of a personal interaction we thought is going to have a lot of leverage when it comes to when it comes to patient when it comes to giving satisfactory output for the clinicians. So this is how our report looks like. And along with that, we also gave photomicrographs also. So initially when we started, I didn't buy any eyepiece cameras or like, digital cameras or anything. I used my cell phone itself to click photographs. I cropped it and I put all this, I marked the parts and all, and I gave it off. And we don't expect that the clinician is going to understand whatever is being given in the histopathology, but at least he'll feel like for the same amount of money, he is getting something more. So that gives like more of a happiness for him when he gets a report. So the pricing, what we did was we put the same price as that of the other established labs. So one mistake when very often like will happen when you start with the practice is people think that if you reduce the charges, like the clinicians are more inclined to give you cases, but that is not true. Because if you try to reduce the charges, what the customer or the client feels is like you have a substandard service. So that is the reason why you are reducing the charges. So you can put the same charge as that of the other established labs. But what we can do is that for the same charge, give more value-added services. So that way, they will have an inclination to give the cases to you. So this is the way in which you have to initially attract the cases to you, because like you may be unknown to those people. Those clinicians may not even know about you. So this is the way in which you can approach them, say that I have all these things, services available for you. So you give me one case and let's see like how it goes. So that is how they are also going to think. Let me give one simple case to him, to that particular lab, and see how their output is going to come, how their results are going to come. If I'm happy with the services, I will continue with that. So more value added for services that we give for the same price is we give photomicrographs along with that, and calling each doctor and discussing the case before delivering the report. This is something that I have seen with my sir, like Rangan sir. Before giving report to giving the report, like he will call the clinician, he will talk and he will discuss the case. And so they will have a lot of doubts and apprehensions about this particular case. They may have a lot of doubts to be clarified. So they will have an opportunity to discuss that case with you. You become a part of that, the patient care team. So that is very important. And the tissue pickup. So that was one of the services that we had initially offered. Now, So with all this kind of background, like we thought about, like we started with establishing the otopathology lab. Now, what you need to understand is, like, to establish a histopathology lab is not very expensive. You have to spend only 1,50,000 or something like that. So when you are planning a clinic, like, which is going to cost around 10 lakhs or like 15 lakhs, spending a 1,50,000 is not a big thing. And so otopathology lab or a histopathology lab is not a very expensive thing. I'll explain to you like how the breakup of the expense is going to come. And the recurring expenses has to be kept at a minimal rate. So I'll tell you like how we managed to keep the recurring expenses or monthly expenses to around 10,000 or 15,000 per month. So in 2016, when we started with, when we established the lab, so you know what are the basic things that you need in a histopathology lab? You need a wax bath or an incubator. You can get that for a 15,000. Local made wax bath or incubators and all. With incubators also, you can melt the wax. So that will come around only for 15,000. You can get a reasonably good one. We have in Perumbavoor here and all, like Kemi, one company is there. They are giving these things. And since local companies are there, like any repair comes, you can take it over there and immediately they will do the repair and you can bring it back to your lab. Then slide warming table, another 15,000. Tissue flotation bath, another 15 to 14,000. A microtome. This is where, like, don't think about investing too much on a microtome, because you can get a microtome for around like 4 lakhs or 3 lakhs and all. But I have seen when I was being there in other colleges and all, when I had worked as a senior lecturer in many colleges, I have seen like people using the old Westworks microtomes, which is a very sturdy one and a cheap one. And it will cost only around 60,000 rupees. And you can put a blade adapter, and you can put a Leica blade onto that, and you can get reasonably good sections. So initially, when you're starting the lab, don't invest too much onto the microtomes and all. Don't put like 3 lakhs and 2 lakhs microtomes. You don't have to buy that. We have used this Westworks microtome pretty efficiently for past 3-4 years, and after that only I have bought a new microtome now. So initially, when I bought that microtome, it's around 60,000. I think now we can get it for around 80,000 now. In 2016, I got it for 60,000. It's a Westworks microtome, and it will give you reasonably good sections. And like, you're not going to get like everyday lymphomas or things like that, sarcomas and all. So for periapical granuloma, cyst and all those kind of things, this will easily work. You can make the diagnosis with that. And the microscope, you can get a reasonably good microscope from Lawrence and Mayo or Labomed for around 20,000 or something. The consumables, you need alcohol, isopropyl alcohol, some xylene, you need paraffin wax, you need hematoxin and eosin. Maximum special stains you need is PA staining, you need Van Giesen, you need musicarmin, you need. So for all these kind of things, and you need some jars, like if you're doing a manual processing, with 20,000 bucks, you can manage the consumables. Furniture and all I got from my home, and I put it over there. And we made the lab because we didn't had any walk-in patients coming over there. So there is no point in putting a lab in a town area. If you go into a city or a town area, and if you try to rent a place, the rent is going to be very high. So this place, like where we have rented, was around 170 square feet space, or 150 square feet space. And the rent was only 1,200, and the deposit was only 5,000. So it was in a panchayat area. So the paperwork also, all these kind of legal paperwork that you have to do is also much more easier. It can be easily done with a panchayat rather than a municipality or a corporation. So the what do you call, the ward member and all will be very close to you. So you don't even have to go to the panchayat to get the things done. You tell them, like, they will go and do everything and give it back to you, because the next time they want your vote, because like from the same place. So the total establishment expense came around only for like around 1,50,000. And what about the recurring expenses that happens every time? So the lab technician salary was 5,000. You're thinking like how I got a lab technician, a histopathology technician for 5,000. If you employ a histopathology technician straight away, the cost is going to be, they will charge that their salary will be somewhere around 10,000 to 15,000. So instead of that, I got a DMLT technician, an ordinary diploma technician, and I trained that particular person in histopathology techniques. So that way, she was ready to work for 5,000 rupees as the basic salary. Then what I told her, that what I was doing with them was, I told them that for every case, I will give 100 rupees incentive. So that way, if the number of cases increases, their salary also increases. When my number of cases goes down, their salary also goes down. But whatever may be the number of cases, she will get 5,000 rupees, and then extra benefits will be coming as the number of cases are increasing. So that way they were happy. So when the cases increases, she will be also happy along with me, because she is also going to get paid at a higher rate. Next is the electricity charges were around 1,000 rupees per month, and the medical waste disposal by image was around 1,500 per month, and the rent was only 1,200 per month, and other expenses which includes consumables like to the maximum it can come around 5,000. So maximum my total expenses for a month for running a lab is around 15,500, and if I'm able to get around 20 cases per month, it will become break even. So I was initially charging around 650 rupees, and later I started charging around 850 rupees. Out of this, 100 rupees will go to the technician, plus 750 rupees will be there with me. So once these things were being established, like we wanted to canvass the dental surgeons. So until then I was working in a dental college, so I didn't have much contact with the dental surgeon. So we made, like, along with my partners, we started to go and have a personal visits to the dental clinics, along with brochures and all, and we will try to convince them, to tell them that we are starting a new venture like this, and we will try to convince them to give cases for us. And sometimes you can you should know that, like, when you go for these things, like, they may keep you waiting in your waiting room, even though they don't have any patients. Also, they may keep you waiting in their waiting room for around half an hour and all. So you should not feel any ego or anything like that. You should understand that you're trying to establish a business there, and whoever is sitting inside is your client, and you have to win that client for your business. So you should not have any of those kind of. You should be very humble when you go for all these kind of personal visits for dental clinics. Next is, like, another group of people who are going to really contribute to your business is going to be oral surgeons and periodontists. So we also made personal visits to oral surgeons and periodontists. Most of them will be working as consultants in these clinics. And we also contacted the local IDA branches. And then we made a brochure like this, a nice brochure. And we planned, and we had a kit like this with the brochure. We had a formalin bottle, and it's all branded with our logos, and with biopsy bottles. And we gave this kit to each clinic. Then we invited them for launch and we had associated with the local idea branch, and we said that we will conduct CD programs, and we had to sponsor it completely because we were in the starting phase. And so we started with the launch, and it was going to be inaugurated by not an oropathologist, but a maxillofacial surgeon, because you should understand that we are trying to run a business here, and our major clients are going to be surgeons. So it was inaugurated by Dr. Varghese Mani sir, who is one of the pioneering surgeons, maxillofacial surgeons at Kerala. So once Varghese Mani sir inaugurates or launch this particular lab, all the surgeons is going to notice, like, oh, okay, the Varghese Mani sir is attending one function, he's doing something. So immediately their attention will be captured by this. So that is how we have to bring the attention of the dental surgeons and the maxillofacial surgeons to our practice. And this is where, like, you can see all our partners, the IDA members of Malanad IDA, and Varghese Mani sir, like, after the inauguration and the launching of this Nirnaya Orofacial Diagnostics. And along with that, we also conducted a CD program where we tried to convince or show them the cases where in which the histopathologic diagnosis actually made a lot of difference in the way the patients are being managed. So with that, we thought we'd be able to convince the dental surgeons to do more biopsies and give more cases. So this is how we started with the labs. And let me now share with you the experience that we had over the past 7 years. So the formula for there's a formula called H is equal to E by R. That is, happiness is equal to expectations divided by reality. So these were all our expectations. These were all the things that we were expecting to happen. But in the end, like, you can't expect all these things to become successful. Some failures will be there. Some things will become successful. But whenever failures are there, you should not get disheartened. You have to improvise, and you have to find a new solution for it. So if you try to analyze, like, who all are giving cases to us, you can see that 51% of the cases were given by oral surgeons for us, and the rest 23% was by oral medicine consultants, and around 15% were by general dentists, and 11% by periodontists. So these were the group of if you break up the clients like who are giving cases to us, this is how it appears. So how the really cases come to us, you can see that the dental clinics or the general practitioner can give directly cases to us, or sometimes it is the oral surgeons or the periodontists. They go to a dental clinic, and they get the surgeons get the cases, they give the cases to us, and when the report comes, I will give the cases back or the report back to the surgeon, and also I will get an opportunity to interact with the dental clinic. So this way, from the references given by the oral surgeons, I will be able to get more and more dental clinics. I will be able to interact with more general dental surgeons, and that way more and more people will start coming and giving cases to us. So the challenges what we faced was, it was actually an emerging market. Even the dental surgeons were not much aware about oral mucosal lesions, or they were not taking much biopsies. So we had to initially create an awareness and create a market for ourselves. There was no existing market. We have to create a market, and we have to get the business going. And the next one was really the general practitioner themselves. So let's talk about general practitioners when it comes to oral mucosal lesions. What are the perceptions of a general practitioner? You should understand that, because they are going to be one of your major clients. One is they have a big difficulty in making diagnosis. They are not at all proficient. Most of them have got a lot of difficulty in making diagnosis, and they are very uncomfortable in taking biopsies. And for them, it's very difficult for them to convince the patient for doing a biopsy, because every time they have a feeling like if I tell them that they have to take a biopsy, the patient will become very apprehensive, very tensed, and become going to be a big problem for them. And another major issue was the time versus money. The amount of time they're going to spend with the patient. Like if they spend on a patient for an RCT or doing an implant, they're going to make like triple or quadruple times money than managing your oral mucosal lesion. So most of them, they don't want to manage oral mucosal lesions. So they just ignore like these mucosal lesions. So they consider it as a headache. So that is a common perception of a general practitioner that I have seen. So you may think that when you're starting a practice, if you go to a busy and established dental practitioner who's having a lot of OPs every day, you're going to get more biopsies. But that is something that I have seen that is not right, because these people, they have already established a practice, and like they're not going to change the way they're going to practice. They're going to follow the same set, and they're same way they're comfortable, and they're not going to change the way they're going to practice. So you can go to them, but don't expect, if they're not already taking biopsies, don't expect that they're going to start taking any more new biopsies. Now you have to look at the young dental surgeons who are starting with a practice. For them, each patient is important, each procedure is important. So a person who is starting with the practice, if you approach that particular dental surgeon, you have a better chance of getting biopsies from them. So they may start like experimenting with biopsies. They may start trying out biopsies, and you may get a lot of cases, and you establish a relationship with them. You are going to get a lot of cases out from them. And the other group that you have to really focus on is dental surgeons who have surgical skills, like oral surgeons and periodontists, and some general practitioners who are extremely good in surgeries, and they will take a lot of biopsies. Like they don't have to be even oral surgeons. Now, how to reach the potential customer? That was the next question. Like, because like going to each clinic was not very practical, because there is a limitation, like, a lot of time is going to be wasted. So we felt like one of the ways in which we can approach them was by advertisement. But we understood that this advertisement is not really going to work, because the relationship between a clinician and a pathologist is a lot of trust is involved in there. The reputation of the clinician is going to be very much dependent on the reports that is given by the pathologist, because he's going to make his treatment decisions based on the reports given by the pathologist. So just by looking at an advertisement, nobody is going to give you cases. But instead of that, if you conduct training programs, and you will have an opportunity to directly interact with the clinician, and that is an opportunity where you can we can actually convince them to give cases for you. So CD programs on the importance of biopsy procedures in dental clinics. So those kind of training programs, if you can conduct, that is going to be really beneficial. So here, so the kind of key points that we actually put in the brochure is adding value to your practice, because for the general practitioner, the practice is everything. So you say that you're going to add more value to their practice. and you say that you're going to give a hands-on training and punch biopsy on animal tissues. So these were like some of the along with ideas we have conducted. So after the first thing, we have done like nobody has charged anything from us. Like we have gone there, we have given it free of cost, but they have arranged everything. IDA people have arranged everything for us. So we have done many IDA training programs for the dental surgeons like this. So many every 3 months we'll be conducting one program in various IDA branches. So when we go for this CD programs, we don't give lectures like okay, red and white lesions. If you start giving lectures like that, nobody will sit and listen to your lecture. So what we have to do there, all these practitioners, they are interested in listening to your experiences regarding managing of cases. So I'm just going to show you one of the cases that we, like many cases we'll discuss. This is the one of the cases, like these are the kind of cases that we discuss in these kind of training programs. It's a 39-year-old female patient who had a history of extraction on a partially impacted 10 months back. So an erythematous growth has occurred on the site of where the previous extraction has happened. So you can see here, there was an extraction. This is an extraction area where 10 months back an impaction was done or an extraction was done. And in that area, after 10 months, a sessile swelling or a growth has come over there. And when an OPG was taken, you can see that that particular area where the teeth was taken out, that bone loss is only there. Otherwise, nothing much. And the tissue was taken and histopathology was done. It was nothing other than a follicular ameloblastoma. So here, when we discuss this particular case was kept for a particular reason, because you can see that somebody has done an extraction in the area where the extraction has done. 10 months back, the patient is coming back to the same clinic saying that there is a growth coming from there. So this gives a message. The message that we're going to give along with that is submit the tissues that you get during extraction, that is a periapical or follicular tissues, for histopathological examination. So after listening to this particular case, the general practitioner will think, okay, like what if if I'm extracting and I get some tissue, and what if it is some kind of a pathology, and if I miss that and later something grows out from that socket, I'm going to be in big trouble. If that kind of a message gets into his head, definitely whenever he does an extraction or does an impaction, whatever tissue he gets, he's definitely going to send it for a histopathological examination. That itself is enough for making your practice a successful one. And you have to specially mention about the liabilities, like the criminal liabilities or the legal liabilities that can happen, the litigations that can happen along with that. If you don't give the tissues for histopathological examination, you miss a case, and later what if the patient sues you? If you put that message also along with that, all these people are going to send the cases to you. So these are the training sessions that we do. Like we get around 40, not like how when we do rotary endodontics and all, implantology and all, we'll get around 30 to 40 doctors will come usually for these kind of training sessions when we organize it with an IDA. And we have these kind of banners being put over there. And we use animal tissues, goat tissues and all, for they can do or practice punch biopsies. So that is going to be an added benefit for them. So they will get trained, or they will have a feel of how this punch biopsies really work. And we give them complementary kits. So we give them these kits like free of cost, because we know that once you give this kit, they will have, like, next time when a patient comes, they will be inclined to do a biopsy. And we also give them a punch also free along with that. This punch, when you buy it in bulk, it will come very cheap. And you give this punch to them, like this punch will go and they will take a biopsy from there, with this punch, and the case will come back to you. So that is an opportunity for you to get introduced to that particular doctor, and from there onwards, like, your relationship starts. So that first contact, you have to do these kind of things in order to get that first contact with the dental surgeon, and they should feel like, okay, let me send one case to that particular lab and let me see how it works out. So in 2019, when the COVID started, like, we used to have a lot of webinars like this. So online programs, you will get a lot of participants. Right? Offline programs, you get less participants, but in offline programs, you have better possibility for direct interaction. And when you do hands-on and all, like, you have a lot of opportunities to interact with them. So that is going to be a big advantage, because the potential users of your service after a CD program, what I have seen is, If you're looking at a online CD program, only 1 to 2% of those people are going to use your services, or they're going to come and give the cases to you. While in offline CD programs, around 10% of these people are going to start giving cases to you. If you conduct a CD program in an IDA, where around 50 participants are there, at least 5 or 6 of them are going to start giving you cases. So one of the successful things that we have seen is about conducting these kind of CD programs. And you just say that you're going to give a hands-on course on hands-on. Whenever they hear hands-on for a cheap rate, immediately they will all the dental surgeons will come and join for it. You say they are going to be hands-on for punch biopsies, they will easily come for the CD programs. Now, another challenge that we faced was logistics, because we had initially promised that we're going to give an on-call tissue pick. And then we started to get calls from, calls for cases from all over the Kerala. Then we found it really difficult to arrange this tissue picking the tissues from cases from different areas. One approach what we did was some of these dental lab people, they already have people going around in Ernakulam city and all, picking their cases. So along with that, we have made an arrangement with them so that they can also collect cases. Even now we are doing that for our old customers, but the new clients and all, we are now insisting that we have made boxes for them to send it as a courier. Nowadays we are using this courier. So we have now limited the direct picks, and where reliable sources are present, we are limited, and we have started courier packs for tissue transport. So this usage of couriers actually helped us to get a pan-Kerala presence, because nowadays we are getting cases from Palakkad, from Trivandrum. So from all those places, much more easier and much more convenient for us to get these cases through couriers. And we don't have to give any charges. The whoever is sending only will bear the charges. We are not bearing any of those charges. But if I am asking somebody to go and pick the tissues or cases from the clinics, I have to give some kind of charge. I have to give some kind of a charge to that person who is picking up. So that is going to reduce the profit margin for me. So initially, this is the kind of kit that we used to give. But instead of that, now what we are giving is we have made courier packs where already addresses are there. Then inside that, we have boxes. Inside the box, we have white mouth bottles, and which has been put in another casing so that during the transportation, it will not get spoiled, it will not get destroyed. And along with that, we give formalins in branded bottles also. Now, one of the important things, especially when it comes to setting up on your own practice, is knowing what you don't know is very important. It's very, very important, especially when you are managing the cases by yourself. You have to understand what you can't manage, and then you have to get help from others. So you have to have a group of people who are going to support you. You need to maintain a relationship with them, so that whenever you have a difficult case, there should be enough support base for you where you can get feedback from. Now, one advantage for pathology practice is, unlike a surgeon who has to make a decision then and there, for us, it takes around you can take a period of around 1 week time for you to get to give before you give the diagnosis. So this 1 week time, you can actually go around, and if you have a difficult case, you can get opinion from senior people and get this case sorted out. So it's very important that you need to have a good relationship with the general pathologist who's attached to a lab which has got an IHC setup, so that you can, if you want to do an immunohistochemistry on your case, you have to have a lab access and a general pathologist who is willing to discuss the case with you, and where you can get an inputs from that person. And you can also have contact with the experienced senior oropathologist who can also give feedback for your cases. And your own professor will be the best person who already very well. And you need to have a contact with the dermatologist and a physician, because there will be going to be so many scenarios there in which you have to clinically correlate, and you may need an expert opinion from these specialists also. So now what we have is we have cases coming from all over Kerala, and we have people who are regularly sending cases from these wherever the flags are there and wherever the triangles are there. Those are the places from where we get regularly cases. Some people they send 2 or 3 cases in every month. So that way, like we get regular cases nowadays. So nowadays, like we are now, after this 2 to 3 years, we have a pan Kerala presence throughout the Kerala. People are sending cases to us. So how many cases we are being getting like till now is the next question. So we can see that this is how for the past 7 years, like it's a 6 months break. I have shown like how these number of cases have come. So you can see that here, this is where we started. Initially, when we started, like we used to get around 10 cases in a month. That's all we used to have. So in a year or a 1.5 year period, like we were able to increase the number of cases to around 20. That is when we became break even. So by around 2016, means by around 2018, we had around 20 number. The number of cases that we used to get was around 20. So as soon as it became break even, we had another problem that happened. That was in 2018. You know that like there was devastating flood in Kerala. So that is when like the number of cases dipped down. Then again the number of cases increased after that. Then came the 2019 and 2020 Jan, that period to the 2020 period, where we had the COVID lockdowns, where all the clinics were shut down, and we had a severe reduction in the number of cases. Still, we were able to, whatever cases were coming, we were able to process it, and we were able to give the reports. And now, like we are getting around cases of around like 35 to 40 cases in a month, and we are able to get a profit margin out of it, around 10 to 20,000 rupees we are able to get per month. And so what are the advantages that we had? The advantage is like we had a beginner's advantage. There was nobody else doing this kind of a practice. So it was easy. We didn't have to compete with any other pathologist for this private practice. So this, and another one was like low investment. We didn't invest much. We actually, when we started, like what we talked among ourselves, like me, Jubin, and myself, Jubin, and Dr. Karish, was if you go for a conference, the cost is around 10,000. Cost is around 1 lakh, like all the train, like and flight fares and the registration charges and all will come around 50 to 70,000. It will come. So we let us spend 1 lakh and don't go for a conference for 1 year. So we will be able to compensate that, and let us invest in this practice, and let's see how it works out. And if it fails, like there is only 1 lakh we are going to lose. Each of us are going to lose only 1 lakh. We will just consider this as a kind of risk that we are going to take. So the low risk only was there because we had only low investment. And we were able to establish, since we were the only people who are there, like running this kind of a practice, we were able to establish a network and a brand value and gain the trust of the clinicians. We just had to get one case out from one clinician, and how you communicate matters a lot. And because of that, like you gain the trust, you get the friendship. I have a lot of these contacts with all these surgeons. Like I've never met them, I have only talked with them in the phone, but a lot of friendship you can create, and a lot of like contacts you can create being a pathologist. Now, the disadvantages that I have faced with this kind of a practice setup is it takes time to establish this practice, because you have to gain trust. And so it takes time to establish this kind of a practice. So growth is very slow, and it is an emerging market. You have to train people, they have to convince people to do biopsies. So it's an emerging market, and it has got a slow growth, but a slow and steady growth. But the growth will be sustained. It will not go down, because these people, once they are in your influence, or once they are convinced that you're good, they'll keep giving cases to you. They will never give cases to anybody else. So the future, we are planning to increase the number of cases, build up the number of cases. And we want to build an online community where like we can have regular interactions. We can send like short videos on like how to manage each kind of case, or how to diagnose a white lesion and things like that, where we can have case discussions. And you can use the same setup or the same histopathology setup, and you can do contract research. People who are doing PhDs, who are doing dissertations, they want your IHCs to be done. The same setup can be used. IHC is nothing big. It is just putting those antibodies on the top of the slides, nothing else other than that. So the same setup can be even used for contract research. I'm doing that easily. You can make a good amount of money. IHC enough is enough. And sometimes they like, some people who are doing animal research and all, they may want to process their tissues and get some kind of an interpretation out of it. So I said, like, I'm an oropathologist. I don't know how to check the liver and all. They said like, or what the report that we are getting is not from a general pathologist. I'm getting it from a technician. So you'll be better than that. So then I bought one atlas and saw how these what you call GI tract histology and all is there. And I used to give, that's risk free. Like you don't, they're not going to no treatment is going to be based on these things. So you have to give like reports. You can give reports like that. So that is for animal research and things like that. So you can actually venture into contract research if you have a lab setup like this. And radio diagnostics with the CBCTs and all those kind of, if Dr. Karish comes back from, he's now in Middle East, comes back, he's an oral medicine person. If he comes back, there will be an opportunity for us to start with the radio diagnostics. And we are also planning in course of time to start with a specialty oral mucosal disease clinic. We have 2-3 oral medicine consultants along with us, and who can actually who can be utilized for this particular specialty clinic. So this is how we started with it. Now, as we were experiencing all these challenges in this practice, I felt like there is other opportunities also available. Other business alternatives are also possible, because I had a job in a dental college, so I had a regular income coming, and this was only a side income that was coming along with that. So if somebody wants to start a clinic or somebody wants to start a lab, and that is the only income that is going to happen, because the growth is a pretty slow one, so you may not be able to make a livelihood out of an exclusive oropathology lab by itself. So an alternate business possibilities are there. So one of the things that I felt like is going to be very much feasible is having a dental clinic, along with that having an oropathology lab and having a consultation. So if you're planning to set up a dental clinic, you may have around 10 lakhs or something along in your hand in order to set up a dental clinic. So if you can set up a small oropathology lab also along with that, that is going to be an added contribution to your dental clinic. And you can have, just like how an orthodontist goes and does consultations, you can go and have consultations in other dental clinics for oral mucosal lesions. You can take biopsies from there and bring it to your lab, process it, and give the reports to those clinics. And you can use your dental clinic as a oral mucosal specialty clinic also. And the technician who is there in your oropath lab, if they don't have enough cases in the pathology lab, you can utilize the same person as your receptionist or your dental assistant. So that way, like the salary that you're going to give for the technician is not going to be wasted. So I feel like this is one of the areas where the future oropathologists have got a lot of possibilities. You can do your specialty practice at the same time. You can gain the initial incomes from your dental clinic in your general practice also. So combining general practice with an oropathology lab is going to be, I think, an excellent opportunity that people has to look into. Because like setting up an oropathology lab is going to cost you only 1,50,000. Less than 2 lakhs, easily you can start an initial lab setup. So another alternate business possibility is having a basic hematology lab with that of an oropathology lab. You know that hematology labs are going to be like, if you want to get the automated machines and all those kind of things, is going to be expensive. But now some of these labs, the corporate labs that have come, who are running it, they are not anything. They are just ordinary people. I have seen one BS graduate who is actually running one of these labs, and they function only as a collection center. The only equipment that they have got over there is a centrifuge machine, and they collect the blood, they centrifuge it, they separate the serum and all those kind of things. Immediately the courier people will come, or the collection agent will come. They will take the specimens to Ernakulam. Within 3-4 hours they will get the reports. So the only equipment that they have to get over there is the centrifuge machine, and they need to have that space. That room space also has to be there. It has to be furnished. So this kind of a basic hematology lab, you don't have any risk of giving any report. You don't have any headaches of conducting the interpreting the results or conducting the test. You just have to be a collecting area or a collection area. From there, like, the cases will go and immediately the results will come, because it's all, like, hematology is basically an automated process where the input of the pathologist is not going to come much. So if you can, this is one way you can establish a basic hematology lab with minimal investment without even purchasing an analyzer. And along with that, you can have an oropath lab also. So this is another business possibility. And the third one is like becoming a consultant in diagnostic labs. Now, this is where, like, if you go when you are an oropathologist and you go to a big diagnostic lab and you say that I'm an oropathologist, I want a job there, nobody is going to give you a job, because what the owner of the lab is going to think is, the general pathology, I'm already employing a general pathologist, and the number of oropathology cases which are coming over there are very less. And even if it comes, the general pathologist is able to give some kind of a report for that. With that, like, somehow I'll be able to manage. Why should I pay this person separately, and why I should have this unnecessary expense going to come to me? That is how the owner is going to think. So if you want to become a consultant, how you should approach is, you need to have enough contacts with the surgeons, and you should go to a lab and say that I have many surgeons whom I have in contact with, and they have want to give cases to me, and they want my reporting. So I want I want a facility where I can process the tissues. So can you give me the facility in your diagnostic lab, and can I report from your lab? So I don't want a salary or anything. Whatever cases comes, like, you can take the charges for processing, and I will take the rest of it, and I will do the reporting. So that way you automatically becomes a consultant in those diagnostic labs. And without spending any money on establishing the lab, you become a part of a large diagnostic setup, and you will have your own cases with you. So there is one person who has done the same. That is Dr. He is a part of this big lab that is in Thrissur, that is called the Sudharma Metropolis Lab. And that is Dr. Anthony George. He is the professor and head in MES Dental College Oral Path Department. And before he came for oral path, he was the assistant for, I think, Dr. Varghese Manisa. So he already had a lot of contacts with maxillofacial surgeons. So nowadays I don't get any cases from Thrissur, because Annichattan is already doing a lot of practice over there, and they already are very happy with his reporting. But I think that is one way in which, like, without spending any money, you can actually start having your own practice. And this is another example. It's about our Srinivasan sir. Like, he is having a lawyering practice, and along with that, he has now started a small practice, like weekly once. Just like a physician, he'll be sitting with a chair and a table, and he gets patients with oral mucosal diseases, and he treats them. So he has put this board and saying that Vaile Charmaroga Vidaktan, or the specialist for skin of the oral cavity. By seeing this board itself, like, people who, without any other advertisement, people have started coming to him, and I think he gets around one or two to three cases in a week. He has this consultation, this particular pace, once in a week. So the time is gone when a pathologist used to be a faceless person behind a report, like, and nobody knows who it is. Now, if you want to thrive, if you want to have a good practice in our pathology, you need to have, or in a pathology practice, you need to have great communication skills. So what you need to remember is that if you are a postgraduate student in pathology, this is a time when you want to when you have to have contacts now. This is a time when you have to have friendships built with the periodontists, oral medicine people, oral surgeons, and all the other branch specialty, because you have to understand they are all your potential clients later. Initially, when you the initial phases, when you are finished your oral path post graduation, when you're coming out, these friends that you have made in your dental college should be the first people who should be ready to give the cases to you. So you should, when you're post graduation, don't fight with any of your colleagues in the other departments. So that is something that you have to keep it in your mind. Now, when it comes to the postgraduate training, I will say that it is very important that our postgraduate training or pathology training has to become more clinically oriented, where in which the pathologists, the oropath postgraduates who are coming out should be able to do clinical diagnosis of oral lesions. They should be trained to take biopsies, and they should have an exposure in the medical management of oral lesions, and they should have even an exposure to general dental practice during their postgraduate training, so that as soon as they come out from their postgraduate training, they should still have that touch in the general dental practice, and they should be able to set up their own clinical practice. And in that way, I'm very happy to say that my management is very much supportive of us, and our postgraduates are getting trained in impactions like implantology, RCTs, and even they are taking biopsies in the second years, and the first year they are doing all these things. So the take-home message is we need to have an economically, we are able to establish an economically viable business model in our pathology practice. So that means that, like, if you start with our pathology practice, it's not going to get doomed or anything. You're going to get cases. There are few challenges there, but we should be able to address those things, and we should be able to go forward. And the role of an oropathologist, and if you want to become really a successful pathologist, is to support and empower the clinician and become a team player in the patient management. And when you try new things, like, things are going to get changed. Like, sometimes things, there can be what you call failures can happen. But instead of getting disheartened, you have to keep improvising, and you have to find solutions, and you have to learn from your failures. So we have to say that oropathology, definitely as a specialty, we face challenges, and you can actually consider that as a big problem, or you can convert those challenges into opportunities. It's up to you to decide what to do about it. So if you just imagine, like, the postgraduates expert, what do you expect? Do you expect that as soon as you finish your oropath post-graduation, people are going to come and ask whether can you come and please join your college, or, like, can you come and do this job? Nobody is going to come and offer you any kind of job. Do you imagine that the other specialty people, like in conservative or live in ortho and all, nowadays orthodont, there are a lot, like, all these clinics have got orthodont, it's all saturated. Initially the people who are coming out from orthodontics post graduation, they have to go to each and every clinic. They will ask for a consultation, like, as a position as a consultant, and it takes around 3 to 5 years for them to establish themselves as a successful consultant. So the struggle is not only for oropathologists, for every specialty the struggle is there, and we should not expect that the people are going to solve the problems for us. We have to find our own solutions. So if you want to become successful, it all depends upon your attitude and your how much you'll be able to improvise based on the experiences that you gain. So I'd like to thank my teachers, like Saraswati Madam and Rangan sir, for, like, making me what I am, because the skills that I have learned from them is what I'm able to do now. So I have to place my gratitude for them, to express my gratitude for them. And I would also like to thank my department, my postgraduates, and my colleagues for supporting me all the way around. And in the end, the most important thing is, like, you should have the God's grace. Always prayer should be there. Each case you handle, mistakes can happen at any time, and the right thoughts has to come in the right moment. So that you should always be humble, and that God's grace has to be always there with you to make a successful practice. So thank you so much for your patient listening. That's all.
Thank you, sir. Now I call upon Dr. Maji ma'am and Nivedita ma'am for your valuable inputs.
I'll just stop my screen sharing. 1 minute. Yeah.
Good evening, all of you. I'm very happy to be part of KSO in the program once again. So thanks to Mahija and team for giving me this opportunity. And Deepu, hats off to you. It was an excellent presentation, and only you can do this. I would definitely
thank you,
say.
madam. Thank you so much,
yeah,
madam.
Because you have, you've been so generous. I have to acknowledge that. And I don't think anybody will be so open-minded, explaining each and every aspects of, how to set up a lab, where you yourself, you have mentioned that you never had any model in front of you. And everything is, from scratch, you made it. And then you were so generous that, you have explained everything to people. So, it's so easy for somebody else to take up this in future. And you have covered, how you have developed the business model and have to make it economically viable. And also, how you have empowered the clinician so that, you ensure that the flow of clinical materials to your, lab and, everything. It was really, really informative. And the challenges you have faced, everything. So, really, it was a great, session, Deepu. And Deepu, before I open that discussion to other people, let me ask you one question. One thing that, do you follow any quality control system or quality check for your biopsy reports?
Ma'am, what I have done is like, especially for the laboratory techniques, we have, by experience, we have seen like, we have calculated like how many blocks like, or how many blocks be made by the time the, what do you call, the chemicals will get exhausted. So all those kind of checks and balances have been, have been, have been made ready, so that we know that around 50 blocks, if I process, my alcohol and the cyanide will get exhausted, and after that I will start getting problems during processing. So we have made all those things sure, and so that we keep changing the fluids and all those things in the right moment. So we have already standardized on those things, and we are doing those quality controls frequently, madam.
This biopsy reporting, any NABL, do we have to go through any of this inspection process or anything like that?
Ma'am, at present, we don't have to do any of those things. Like if you have an NABL accreditation, it is going to add more value to your practice. But for that, the number of cases has to still go higher. So we are waiting to a period where in which like we'll have more number of cases. Now we have around 40 cases. But if you go to a general pathology lab, they get around 100 cases in a day. So that is a kind of volume that they get in a general pathology. So with an exclusive oral pathology, still the number of cases has to go higher. Then in future, we are planning to do that. But for giving legally, we don't have any issues in giving a report even without an NABL accreditation. So it should not be a problem for at the time being. But I think in course of time, the Clinical Establishment Act is going to come. And with that, some kind of inspections are going to happen. But at present, what we have is like when we are setting up a lab from pollution control and all those from the panchayat and all those places, for people will come for inspections, they will come and have a check and the things and all. So those kind of inspections will happen. But with Clinical Establishment Act being set up, I think we are going to have inspections in future. So we have now moved from 170 square feet space to around 800 square feet space. Now, even if an inspection comes, we'll be able to manage it. And we keep all the records ready, and we have all the biopsy registers. We have biopsy registers. We have the soft copies of the reports. We keep all the blocks, even though we have mentioned that 6 months we will remove the blocks and all we have mentioned, but still I keep all the blocks till now all the blocks are there with me. So even if after 1 year also a patient comes and they want to have a block back, I can still give the blocks and slides to them. So all those things we have kept in the proper way.
Good. That is what was supposed to be my next question. Anyway, you have answered it along with that, how you maintain the record. Yeah. Okay, Deepu, I'm not taking much time. Anyway, congratulations to you as well as your team, Jubin and Karish. Definitely, it was a good initiative, and may God bless you with more success in your business model. Because that is Deepu's touch. At the end of you have also told something about the human relationship and also God's grace. Definitely, may you have all this God's grace so that your business model let it flourish, and hope that it would have at least enlighten some of our budding oral pathologists, so that they won't get discouraged or they won't feel bad that they have taken oral pathology, because they have to take the profession forward, because all of us are now almost particularly myself, we are thinking of retirement. So the youngsters should take the lead now. So definitely your presentation would have encouraged them to take challenges and go forward.
Thank you, madam.
Yeah. Thank you. So over to Nivedita.
Madam, please unmute, madam.
Hello?
Yeah, ma'am. We can hear, ma'am. No, we can't hear, ma'am.
Now can you hear me, Dr. Deepu?
Yeah. Yes,
Okay,
ma'am.
I think, first of all, thanks to Dr. Sunil and Dr. Mahija for the choice of topic and the speaker as well. And I must say, I think Dr. Deepu is somebody I think whom I have personally known him very closely, right from the days of his student days to what he is, and I've seen the growth. And hats off to you, Dr. Deepu. And like Dr. Maji said, I don't think anybody else could have done that, Dr. Deepu. I think
Thank you,
as
ma'am.
a person, your this thing on humanity, everything, genuinity. I think to come here on such a dais to share it, your every experience, right from the scratch to where you are. I'm sure I think you're going to get a lot of phone calls after today's topic, Dr. Deepu. Everybody will be having some of the other queries, I think, Dr. Deepu. And
Thank
I
you,
think
ma'am.
this was exactly what our specialty needed. I think we all need to be keeping our positivity high, with very much high this thing. I don't think anybody can do anything to our specialty. And like I always say, no, like any specialty for that matter, I think you take a 6 months course in RCT, implant, ortho, and all, and you can start with it. But I don't think oral pathology can, we can
No,
never do such a thing of, taking some 3 or 6 months course. So nobody will dare to come and look into the microscope other than our specialty. So I think that is a point that, nobody can take what we have. And we will always remain. And I think it's just a small transient period. We'll get back, I think, with time, with surely in a very good way, I think. Okay, I think let me not take much time. I think there are some queries in the chat box actually, Dr. Deepu, for you.
Yeah, ma'am.
Let me check. Okay. Yeah. Nirima has asked, do you need to do any special stain any time, Dr. Deepu?
Definitely, we have to do special stains. Like the common special stain, we need to have only 2 to 3 special stains that's routinely to be needed. One is
Okay.
PAS. Every time you need to have it, because like if you are
Okay.
looking for a candle infection, you have to have a PAS, and you need to have some mucicamin also, because once in a while you may get a mucoepidermoid carcinoma and you need to check whether it's a mucin or not. So PAS and the mucicamin together, like it's going to really work for you. And you can have Van Giesen also. So with Van Giesen is a very simple trichome staining. So very easily we can do that. And if you want, like once in a while, have a Congo. So with these special stains, you can easily manage. But IHCs, I really don't go for IHCs, because like once in a month only you may get a spindle cell neoplasm or a clear cell neoplasm or a round cell tumor. And getting all the panel of markers and buying it and keeping it, like within a year time, it is going to get expired. So better than that, I go to general pathology, and where a good general pathologist is there, I get their feedback also, and they will do the what you call IHC panel testing also will be done by them. So that way, I don't have to spend money on IHCs. So I can just I will tell the clinician that I can do the IHC. This much is the cost for the panel. And in I usually get it done in Caritas Hospital, because it's an oncology center also. And Dr. Bindu over there is a very good pathologist, and she is very magnanimous, and she interacts with you. She discusses the case with you. So you also it's also a learning process along with that. As you see more and more cases, like you learn a lot of things along with that. So that is how I go about with it.
Okay. Then, sir, what are the legal aspects in establishing OP lab? Like, do we need to register it like a company, or what are we supposed to do?
You don't have to register it as a company or anything. You can have it as just like how you run a dental clinic, you can run your oral pathology lab. And if you are in a panchayat or in a municipality, you may have to register it in that municipality or panchayat as a diagnostic lab. They may not even know what is the difference between a hematology lab and a pathology lab. You just have to say it's a diagnostic lab. They will be happy with it, and they will come. They are mainly concerned about pollution and all. And once you have the pollution certificate and you have the health inspector coming and checking about all the things, it should be fine. But once the Clinical Establishment Act, if it is going to get done, you may have some kind of an inspection coming from pathology people, like, or doctors and all. But otherwise, there is no other legal hassles in running your own practice. As long as you are registered with your dental council, you are qualified enough to practice your pathology, your profession.
Okay. Does contacting corporate hospital help, or they insist on giving the tissues to their own lab where diagnosis is done by general pathologist?
No, I didn't get it, madam.
Does contacting corporate hospital help, or they insist on giving the tissues to their own lab where diagnosis is done by general pathologists,
No,
contacting
what
a
usually,
corporate
yeah,
sector.
what usually happens is when you go to a hospital, like they may insist that the cases or the reporting has to be done in their own lab. So that kind of a problem will be there. So usually what happens is whenever those people, when the maxillofacial surgeon in a corporate hospital is not happy with the general pathologist report, he usually gives the case and the blocks and slides to me for second opinion. So if I am charging 850 rupees for a general processing, and for blocks and slides I just have to cut some sections, so for that I will charge around 400 or 500 rupees. So it is much more profitable for me if I get more second opinions, because I don't have to waste any of my chemicals, and I can just take some sections and I can charge more for it. So that way it will be much better.
Okay, what are all the licenses that we need to start an oral path lab?
As I already
License,
told,
yeah.
I already told you, it's with the panchayat or the municipality or corporation, wherever you are setting up the lab, you need to get the licenses from them. Otherwise, like if you, the only main thing is that you have to be a registered dental practitioner, and you should have a post-graduation in, post-graduation should also be registered. So those are the things that you have to keep it in your mind. Otherwise, whichever local body where you are setting up the lab, that place, like you have to get the licenses from. I feel like it is much more easier if you can get your lab in a panchayat, because it has got the least legal hassles when compared to that of a municipality or a corporation. Because you know, if you're getting your cases by courier, by the means of courier and all, you don't have to have any walk-in patients. So there is no need for putting it in a town or a city or anything where the rent is also going to be very high. So you put it in a small area, like away from the city. The legal hassles are also going to be lesser. The licenses like that you have to get is also going to be much more easier to procure, and the rent is also going to be lesser.
Okay, there are, I think IHC, I think you've already answered, Deepu. And another question, do you use buffered formalin?
You can actually use buffered for formalin, but I don't usually, I have not till now I have not used buffered formalin. But even with using the ordinary formalin, I'm able to get good results, and even IHC I don't have any issues till now. But ideally I feel like it is better to go for a buffered formalin, because if you're planning to later do an IHC for the tissues and all, buffered formalin is going to give you better results without any hassle. So in future, we are planning to go for a buffered formalin.
Okay, another question is, for tissue processing, you use acetone or alcohol?
I use alcohol, because acetone, like even though they give good results, like they are more harsher on the tissues. So alcohol is much more cheaper, and it is much more milder on the tissue. So I usually go for alcohol, and acetone is more expensive. So alcohol is much better.
There's a question like, if you start a hematology collection center, will it help monetary benefits, sending samples to pathology?
Yeah. Actually, like in a hematology, the profit margin is more than 50%. You can't imagine like how much profit they are making. So if you make a collection center, you can mint money like anything. So, and you need to, the main important thing about hematology lab is you need to have 2-3 general practitioners. What I mean is medical practitioners who are willing to send cases to you, who are having consultations nearby, and you have to put it in the center of those places. You may have to give incentives for them, or you may have to give them some cake and gift and all. You may have to send them and all. And if they are willing to refer the cases to you, you can have a wonderful practice. So it all depends upon your communication skills, how much you are able to convince them to send the cases to you.
Okay, disposal of chemicals like xylene and formalin.
That is going to be a big issue. The xylene and formalin disposal is going to be a big issue. So till now I have collected all the xylene till now, and I have kept it. So it's not easy thing to do it. But we have image waste disposal is there by IMA, but they don't take xylene. So disposing xylene is a big issue. So now what I do is that I collect the xylene and I keep it, because I don't feel like just draining it away, because it's a carcinogen and it is not right for me to do that. So I'm just collected and I've kept it like that.
And I think there's a thing, tobacco cessation clinic attached with oral pathology lab, particularly OPMD diagnosis. Your suggestions?
So, that is a great opportunity over there. And in the college, we are now establishing a tobacco cessation clinic, and you can have this tobacco cessation clinics in your along with your oral mucosal lesion practice, and that is going to give you a great opportunity. So now I'm attending some basic counseling course also, so that I felt like, if you need to have some kind of a training in counseling, and that's very important for you to do the proper counseling for the tobacco cessation clinic. And nicotine replacement treatment easily we can give, so there is no issue at all. And I think there's a great opportunity over there where you can establish a practice in that particular way. And you can even get consultations from other clinics also. If you establish a practice like that, people from the other or the other dental practitioners, they can refer the cases to you. So that way you can establish a good practice in that particular way. But it may take some time, but once it is established, and if you're giving a good service, it is going to be there for a long time.
Then as oral pathologist, can you run hematopathology lab as well?
Now, according to the latest Supreme Court ruling and this thing, and for the DCA and all, what they have said is you can do the hematology if it is been sent by a dental practitioner.
Yes.
So that is how it has been now. But if you look at to any of these labs that has been run, none of it has been run by a general pathologist. So in the end, the reason for running the lab is, again definitely you're going to give a service to the patient, but it's for making the money. And none of these labs are owned by general pathologists and all. It's ordinary people who are running these labs. If you want, you can employ. If you're getting good profit out of it, you can employ one MSc biochemistry person over there, and that is more than enough for as a person to sign the reports. So if you want to make money, you can make money with that. You don't have to be a general pathologist to do all this stuff.
There are two more questions, Dr. Deepu. Do you need to get permission for buying ethanol and disposal of leftover fixed tissue? I think that's a good question. Leftover fixed tissue.
Yeah. So the next problem is like the kind of tissues that we get. We get small incision biopsies only. We are not like, if it comes to a neck dissection or like big specimens like that, it usually goes to a general pathology lab. So we don't have those kind of problems of tissue disposal. But again, the tissue disposal with image is possible. IMA is having this image, and the image is allowing tissue disposal, and that service is being provided by the image services. So that is not an issue. So tissue disposal is not an issue. The other one is about ethanol. We don't use ethanol at all. We are using isopropyl alcohol. So that is not a problem for us. Buying the isopropyl alcohol is not an issue.
So I think that's the questions, and I think more of it is all appreciating and congratulations for Dr. Deepu only. So congratulations, Dr. Deepu.
Thank you,
lots
madam.
and lots of luck. May you grow more and more, so that all of us get, all the old pathologists take home their positivity from you as well then. Thank you all there. Yes.
Thank you, madam.
Yeah, thank you, Madam Ma'am and Nivedita Ma'am. Now, on behalf of KSO MP, I request Deepu sir to accept the certificate of appreciation. Thank you, sir.
Thank you.
I request Maji Ma'am and Nivedita Ma'am to accept the certificate of appreciation as well.
Thank you.
So I request everyone to switch on their cameras for a photo session. Okay, thank you. That brings us to the end of today's session. Thank you, Deepu sir, for that enlightening and wonderful session. And our sincere thanks to Maji ma'am and Nivedita ma'am for moderating the session. Thank you all for your active participation and looking forward to see you soon. And I request you to kindly take a moment to fill the feedback form that has been provided to you in the chat box. Only those who fill out the feedback form will receive the certificate of attendance. Thank you. Good night.
Thank you. Good night.
Thank you. Thank you. Good night all.
I'm Mahija.